ask that you all join me in prayer. Father God, we come to you as your children. We're seeking your guidance, your advice. And Father, remembering that all things are possible through you. Our world is at ill at ease. We cannot fathom and understand. We are mere mortals trying to figure out solutions to things that are beyond our scope. The best of minds, the best of intentions still leave some without solid feeling that all is going to be well. And yet we know, Lord, in your hands it will turn out that way. We ask you to forgive us of our sins and to guide each of us individually and protect and watch over us. Father, watch over our first responders and all those that are placing themselves out just a little ahead of the edge to provide and protect and to serve. It's in Jesus' name that we pray. Amen.
Amen.
Join me in the pledge of allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Now the text is
Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Thank you. Have seats, please. I'd ask if there are any public comments in one of this time. Is there anyone on the call-in that has a public comment to make?
Do we have people on the call-in?
Is there anyone on the line? We put it on the notice, we're made available for compliance with the governor's relaxed things on the Open Meetings Act. We are looking for some other communication means to provide that, to make it even more open and not limited by the number of people that can participate in it. Right now, we're limited to 32 lines. Okay, I'd ask the court to, there's some of you are going to have certain items on the agenda, and I would ask you, if you make that, you get it down, you leave. Let's cut down, and if there's other people need to come to the meeting, but right now we're at the maximum we should have. And your governmental bodies are kind of a little different, but I want to try to follow the heart of this, and if we don't lead by example, then we don't lead. Okay. Consent agenda?
Judge, I would make the motion that we approve the consent agenda with a few.
Okay.
Item 7, it's a precinct 5 expenditure to the Great All, is what KD Services invoice was for.
Item 6, Judge, if we could remove that for right now. That figure is not accurate. We're working on a new accurate figure for the payout for 14.
Anything else on the consent agenda? Is there a second?
Second.
I have a motion by Commissioner White, second by Commissioner Harvey, to approve the consent agenda with the following changes. Commissioner Beecham asked to remove item 6, and Commissioner Watts corrected from Department 224 to the Department 225. All in favor, signify by saying aye.
Aye.
Opposed, same sign. Motion carries 5-0. Item number 1 is review and approve the regular bills for payment.
Motion to pay.
Second.
We have a motion by Commissioner Mahler, second by Commissioner Beecham to approve the regular bills for payments. Any comments? Okay, all in favor, signify by saying aye.
Aye.
Opposed, same sign. Motion carries 5-0. Do we have someone just join us on the call-in line?
Yes, it's Linda.
Oh, okay, Linda, thank you. Glad to have you on. It'll be a little bit before we get to that item that I've asked you all to help us with.
Okay.
All right? Okay. Item 2 is discuss, consider, take action to allow Yates Litigant to exercise their contract option to reduce their retainage on payments to the commissioners for approval. Commissioner Beecham.
Yeah, Judge, same with item 6 on the consent agenda. We're awaiting accurate figures on that. I would like to go ahead and table that item as well until next week.
Just so you know, I'm not in favor of that.
Okay. As I said last week, I understand that, but we should have mentioned that in the contract item.
Well, they're trying to change the contract, Judge.
Sir?
No,
They're changing the contract to lessen their retainage.
no, it's spelled out
That's
in the
allowed in the
contract.
contract.
Mm.
And in the information that was given last week, it quoted that section.
Do I understand we won't be wiring any money then to Yates this week?
They did.
But this bill, this payment 14 is not accurate based on the new contract. They've attempted to send us 2 different versions and it's still not correct. So until they get the correct value to us, then no, we will not be paying it.
Okay. Item number 3 is discuss, consider, take action to delete the receptionist clerk position 405.03 in the Veteran Service Office from the current 2020 budget in order to realign funds and increase current current salaries for the County Veteran Service Office and Assistant County Veteran Service Officer effective the next pay cut. Mr. Murdock is here. He has talked to us individually about this. Do you all have any questions for Mr. Murdock?
No, I'd just like to say it's a great ideal, and then we appreciate all you're turning the thing up on its ear and really getting a lot out of it, and I appreciate that go-get attitude.
Motion to approve, Judge.
Okay.
Second.
Do we have specific amounts on these changes?
He'll send that to you. There's the range. You've got the top range. We're not going to the top, so we're staying within the budget, and there will be some savings too with eliminating that position.
Was there, I want to be clear on that, Judge, let me flip right
Yes, sir.
there real quick. Oh, well, is that item 3, right?
Yes, sir.
Did you,
There's not a backup sheet on it.
no, that's what I was looking at, but there was an adjustment for both of these.
Both these positions. And part of what we're doing there, about 2 years ago, we set those in line with the state people. That's, as soon as we train somebody, they would move up with a difference in pay. Well, things have been much more prosperous in Austin than here, and we were way out of line on the salary. We're competitive with them, but we're not ahead of them, and we're still a little behind, but that's what the money is we had to do. So the plan is, we'll do that in stages as they progress, but Tim has gotten all the certifications he can. He's now active on the state, the Texas veteran site. You have access to that, which greatly enhances our ability. They can now file everything. Tina is just got to get her time in, and one kind of an on-the-job training thing at Waco, go through a week with them, and then she'll be fully accredited. So, I mean, we have never had that situation in the last 8-10 years where we've had both counselors, both fully accessible. And that makes a world of difference in filing for veterans.
Great. agree. But that's all, I just wanted to make sure they,
No, but it's not all at once, it's every stage. So, any other comments or questions? Okay. I have a motion by Commissioner Muller, is that correct?
That's
Second
correct.
by Commissioner Wallace.
Yes.
Okay. All in favor, signify by saying, I'm sorry, any questions from the audience? Okay. All in favor, signify by saying aye.
Aye.
Opposed, same sign. Motion carried 5-0. Item 4 is discuss, consider, take action to approve the purchase of a 2021 Mack dump truck from Bruckner's Truck Sales Incorporated at a cost of $133,747 for Precinct 1 to be delivered in January 2021 and paid from Precinct 1 capital improvements 2021 to lines determined by the county auditor. Commissioner Biggs.
Yes, Judge, this will be an HGAC purchase. I wanted to get it in line since the production lines are shut down, and I don't want to run into the same problem I ran into a year ago with a late delivery crossing over years. I do have plenty of funds in reserve to cover this, so I'm going to buy it outright.
is it a 15-yard
No,
mark?
it will be a small one again.
The,
That way we have a combination of everything.
had you talked to Josh?
Yeah.
Because he should go find you a chassis and put the bed on it that's already, and not, because ideally, he'd rather run it through the assembly line. I wouldn't let him do that. I'd make sure there was a chassis pending out there, just like
Well,
he
we've got-
produced this one in 30 days that we
Yeah.
just bought.
Well, this is for 21 purchase. This
Oh,
is my
oh.
next year's budget. I
Oh,
wanted to
okay.
get it in line early, that way it can be delivered right at the
I
first of
got
the
you,
year.
okay, so it doesn't matter.
No.
Okay. Is there a second?
A
Second.
second.
Okay, motion by Commissioner Beecham, second by Commissioner Watts to approve the item as stated. Any comments or questions? All in favor, signify by saying aye.
Aye.
Opposed, same sign. Motion carried 5-0. Item 5, discuss, consider, take action to advertise for quotes for a Ford F-250 crew cab pickup or equal for Precinct 2. Commissioner Martin?
Sam's pickup, grader, they wanted $12,000 to repair the motor. It's not a $12,000 truck. We thought it would last a couple more years. It's just not worth putting the money in it, so we're just gonna try to go out for bids here locally, see if we can't find something that we can get him into. That's my motion.
Second.
I checked buy board on those also.
It takes 9 months to get it on buy board, Judge.
Okay. The only thing you've used up, you had 2 major purchases planned, and we've done those.
Yeah, this is not planned.
I know. Because that's probably, if you're talking F-250, what price range?
47, I think is what we gave for Don's. What, 52, Willie, wasn't it 52? Yeah.
Okay, how's that gonna come out of your budget?
Probably out of my sealing oil, if it has to.
Out of your,
If it has to, it'll come out of sealing oil.
okay,
I mean, that's, depending on the weather, that's usually my fallout, is if we can't get the roads done, that's gonna have that residual. That's all I know, unless we do a budget amendment.
what is the necessity of that large a pickup? I mean, that's a horse, 250 is,
It pulls our trailers, that's got our rollers on it, and our backhoes,
Okay, so- yeah,
that's,
all right.
yeah, it's also a 4-door, it calls crew, and we're doing patching and stuff. Yeah, in our business, I wouldn't waste my time on a half-ton truck. It just makes it towards, not really usable except for riding around in, and we don't need to be doing a lot of riding around. Well, that's my motion.
Yes, sir.
Any other discussion? All in favor, signify by saying aye.
All right.
Opposed, same sign. Motion carries 5-0. Let's go ahead and take number 7, which is discuss, consider, take action to approve the purchase of Surface laptop, Surface pen, and complete care for 3 years at total cost of $2,066.10 for the county judge to perform video hearings for mental health cases, allowing more attorneys and camera review and to meet COVID-19 guidelines to be paid from Department 401 Supplies and Operations budget with specific lines determined by the county auditor.
So moved.
Thank you.
Second.
Just for everyone's understanding, this is what I'm using right now, and with being the COVID license, we can't go on the state hospital grounds any longer. So the other day, I'm sitting here with the state's attorney, and the proposed patient's attorney and me, and we're all trying to be seen on this one. It doesn't work well. The bigger one will allow us to move it back, have a little more distance. We'll still be within the 6 feet. There's not any way to do that with the current setup. But that will give that opportunity to do that. Since we're doing it to meet COVID-19, I thought it'd be nice to let that pay for 75%.
I heard that.
Any questions or comments on? Motion by Commissioner Watts, second by Commissioner Beecham, to approve the item as presented. Any other comments? All in favor, signify by saying aye.
Aye.
Opposed, same sign, motion carries 5-0. Item number 8 is discuss, consider, or take action on restrictions of travel for Wichita County personnel. What we're looking at there, and I think most of our conferences have been canceled, but what I'm concerned about is putting our people out and sending them, because conferences are generally much larger areas that are having a greater number of COVID-19 cases, that we should restrict this and allow travel only that's brought to and approved by the Commissioner's Court, other than the things that you all do to transport, pick up prisoners, but that kind of thing, Sheriff. But otherwise, any of that optional travel, and I want to be sure not, my definition of option and somebody else's definition of option is Commissioner's Court's definition of option, that the elected official or department head needs to bring that to the court in time for that to be decided on and sealed back reservations and do it. But I really don't see. There's been an effort through the Texas Association of Counties to ask for waivers for continuing education and CLEs and that kind of thing. So because it just doesn't make sense. And I think those will be approved. The governor did some really good acts in medical licensing to let people have interim approval, graduating nurses, medical students and all that, and even to get people that have recently retired and their licenses current, they're just doing a lot of things to beef up the availability of medical personnel. Let me throw in with just I got on that tangent. I got a number of people calling about the National Guard being activated, and we were going to go under martial law. No. The Guard, the governor said in his call Friday that Saturday morning, Saturday afternoon, what he is looking at is that he will activate the Guard to provide support to the drive-through testing patterns, to back up the hospitals and all, and so they will have people doing things, medical service people. I don't know whether he's actually talking about actual medical providers that are in the Guard, because what I'm afraid is we've got them here working in Community X, and they're going to activate them and bring them here and move them, and you might take it a small. I remember the doc we had in our artillery battalion was the only doctor in Vernon, Texas. So we took him away. That would have been a problem. That was a long time ago. But at any rate, that was all that's about. That does not appear to be anything other than that. So, as a court.
Judge, hopefully by the time we get new people coming on board that need, preliminary training, we'll be past this. That's our hope at the end of the year, and I just think it makes sense.
So
Of the
this would be for the
circumstances.
duration of the disaster declaration?
Yeah, that was my question, is what I'd make a motion, we approve that.
Second.
In further discussion, Shepherd Air Force Base has limited travel military and non-military employees of Shepherd Air Force Base to 60 miles. That's not what we're talking about. We're just talking about county required travel.
Yes.
Okay, so we're not limiting our employees
I don't think we could.
to go to Lubbock if they want to. Okay, just want to make sure. No,
I would highly discourage that.
well, Shepherd has put that in place. You're not allowed to go without 60 miles from the base.
Well, everybody out there has to stand and salute the same flagpole. So we don't quite have that far reaching.
But just making sure that that was understood.
County-sponsored travel.
Yeah, our deal is gonna be pretty well self-policing, because like you say, Judge, everything's pretty well been canceled anyway, so something might come up down the road, be good to have policy in place.
They had that Commissioner Marlin there, there, I heard two voices right there. Okay, I'm saying no county sponsored travel other than law enforcement, requirements, which, for movements of prisoners.
Do we need to put a statement in there or anything else related to COVID-19? We don't know what it might be at this point, but COVID-19 related travel, it may be necessary to pick up supplies or other.
Oh, okay, good, good thought.
Daryl, aren't y'all finding it more and more difficult to go to our regular vendors for some supply? You may have to go to special vendors for different things on health-related products or.
A lot of them are sold out, of course, and then of course it's back ordered. And we've been pretty fortunate about getting masks and things. We've had Home Depot had set a bunch of them back because they felt like they might be able to help us, and so we had to pick those up, several cases of those. We'd already ordered a bunch of gloves and stuff for patrol and stuff already, so we're good there. So we're sitting pretty good as far as masks and gloves.
Call for the vote on that. Is there anyone, I'm sorry, anyone in the audience, any other comment?
This pertains only to the COVID situation, as far as asking permission to travel.
Yes, sir, it says for the duration of the disaster declaration. And to remove that declaration, that's a county judge's call. It doesn't take court action at the point we feel it, then I don't have to bring it to court, get their approval. I can terminate it on that there. But just, everyone, I won't do that without talking to the commissioners. That's just way I do business.
Can you read the motion?
Yes, sir. No county-sponsored travel other than law enforcement requirements for movement of prisoners or getting COVID-19 supplies from the duration of the disaster declaration. Okay. All in favor, signify by saying aye.
Aye.
Opposed, same sign. Motion carries 5-0. Any update on the law enforcement center?
Not much, other than they did let us be aware that due to the emergency, our supply lines could be put in jeopardy, so it may end up in a longer duration for the project. They do not anticipate it at this point. They feel like everything has been ordered and headed this way that needs to be, but as this thing develops, who knows what's going to happen with lack of workers and supplies being able to be delivered. So we did have that notification. So, but right now everything is tracking just like it was last week.
Judge, on Lori, did you engage your appointment schedule last week?
It started this month.
Did that go good?
It has so far.
I'd ask Chief Choate to come kind of give us just an overview of what is being done and the control of ingress and egress in county buildings. Just
Last week, it was kind of hectic getting started. Anytime you start something new, of course, it's something new, people really don't like to do something. But after a while, we got things lined out with the help of the publicity that not coming into the courthouse for certain things or whatever has helped a bunch. One of the things that was slowing us down a bunch was the using the thermometers, and we've been looking for the type that does the infrared, which is a lot faster, and you don't have to touch the skin with it. The ones we have now are the type that you touch the skin, you have to sit there for the longest. Yes, sir?
I think I have 2 of those in my pickup, and I think I have 2 more at my shop. I will bring them to you.
Well, look at them on the side label, I was gonna do that too. They, 2 things, one, they say now for medical use, like, well, okay. They also only go up to 88.8 degrees.
Mine go up to 450.
Are they medical thermometers though? 'Cause,
They're the ones I buy from Harbor Freight.
no, they don't work.
Okay.
Yeah, and we went to, I was talking to Dr. Myers, and he was telling me that those that you get for HVAC would use are the same thing. So we went and got some of those for HVAC, which they don't work. You have to get the type that's medical. And so we've tried everywhere in Wichita Falls, we've tried Dallas-Fort Worth area, we've contacted people at Shepherd Air Force Base and at Fort Sill. And we had to order some online, which the soonest we can get those is the 27th, which will be this Friday. That's the quickest we can. But with all of the publicity and of people not needing to be coming as much as we did last week, which is also helping a bunch with the employees here at the courthouse, being different times and whatever, has helped it slow down a whole bunch. And one of the things we ran into last week was people were stacking up as they were getting their temperature taken, and that was where we were having to gather up, and that wasn't good because they were not staying, 6 foot away or whatever. Well, looks like that's helping a bunch this morning. We're not having that problem like we did last week. And I went over to the annex this morning and watched them over there, and it's the traffic is slowed down a bunch over there too. And now they've got one over there that's the infrared that we got from one of the deputies' wives that just happened to have one at the house. And so it's working great. So the thing with these 2, the type that touch your skin, you have to have the alcohol swabs after each one of them. And we're afraid we're gonna run out of those, so if anybody knows where we can get those, if you got some of them in your pickup, you might use some of them.
I'll bring you a bunch of them.
Okay.
Have some at home though, Darrell.
So we're kinda at,
And the other thing we're gonna be doing is I've got date stamps or
Right.
day stamps that we stamp hands, so you only get your temperature taken once. So
Yeah.
when we
They're
have
gonna stamp their hand.
stamp your hand with the day.
What are we gonna do from one person to the other?
That's,
we were thinking about the armbands, kinda like you get at different functions you go to or whatever, and each one of them get a different.
we can go to the,
I press sheet of stickers in that time.
Just something that, for the employees, when they come in early in the morning to come to work, that whenever they leave for lunch, they can just come on through if they've got the sticker that shows.
What about those wrist deals that we use for RCA that just stick on there? It's just a plastic, you rip it off at the end of the day, you know what I'm talking about?
yeah, that was the first thought, but getting those here in time, I can get,
I got some.
you got some?
I think, have to look, but I think we have some.
Well, we can do that.
Okay.
We're just trying to figure out a way to
Right,
identify.
not to duplicate.
Typically, we got people coming from the annex to the courthouse and back several times a day. There's no sense in
Another issue
checking
we had over
temperature.
at the courthouse annex was those that needed to come in to go to the Indigent Healthcare. So we built the petition there so they could go directly there without having to worry about, in case they didn't meet the criteria, they still could get to indigent health care to get their medical attention that they needed.
Yep.
So that was one of the things we
Yeah.
had to do there too. And then, most of the people, when they come up to the door to get checked or scanned or whatever, now then, they're starting to scatter out better. And other than last week, it's a little bit, I think the publicity again has helped the whole bunch with that. And the back door at the sheriff's office, we've got it now to where all employees, regardless of who you are, they come in and they go directly to records and they get their temperature taken there. She notes it, the temperature and who it is, and then they can go on through. That again is if we have the, something that lets them know that they've already been done or whatever would help. But it's broken down when she comes in there, they can, which is not that many, it's all employees that come in that back room anyway. So that'll help much too.
Well, you put your card up there, there's a record made of that card number.
Yeah. But they do need to go right straight to records to get that done, just like all the rest of them. And then the only other door would be the one they're going through the boiler, and we've got that taken care of too. Bob Yo called this morning, or he sent me an email this morning, just let me know, he come through, but went and had checked. So, and if, I guess they had plumbers or whatever that was working back there, he's gonna do the same thing with them to make sure they're checked also.
Okay.
So that way, everybody coming in this building or the annex is being checked. You know, a lot of people that come into the annex over, after coming into the 6th Street side, they get aggravated because it goes all the way around, that's just, you know. But from what I understand from all the deputies, there's, most of the people appreciate what we're doing. You know, there's very little, very little talking bad about any of this. So, they're pretty understanding. One of the things too that kind of slowed us down too is getting those signs made last week. And we got a rush order on all that and everything else that we did, so.
Is there a variance in temperatures? I mean, can that, does?
100.4 and any symptoms,
Okay.
then they're not allowed. 102, you're out. Plus the fact that they've been traveling out of country or something, all those things are asked to them, see if you talk like that, you gotta go.
Mm.
And,
If,
You feel pretty bad at 102.
yeah, you better,
Yeah.
I don't think you want to be.
I don't think you'll do that. Yeah.
But I mean, at 101, we let them come on in?
If they're not showing any symptoms.
I ran into that last week on, with the vet, and I didn't even realize that, you know, I was always told that lamb have anything over 102.7. Well, Ross told me last week, he said, Jeff, that's not right at all. They've got a variance there that, you know, they had, he said at college, our blood draw sheep ran a constant 105. Nothing was ever the matter with it. She ran hotter than normal. And I didn't even realize that there was a variance, and I just wondered if you see that in humans as well. So.
And they need to have something from their doctor
Yeah,
that says that.
but we haven't had that. I don't think we've had anybody that's at 102.
I don't think there's any hot-blooded Americans.
They're
They're all pretty hot-blooded.
Chief, if you need any more signs, we can do a sheet of paper size and laminate them here. We've got that ability now.
We've got some more ordered. I can't remember what they were. I think it was over at the annex. We needed some for showing no exit because some people are still going to the doors on 6th Street
Right.
and they're by the elevators on Scott. And we got them ordered. They should be here today.
Put some up on the inside. We don't have any on the outside, but.
You can't really chain them locked for the fire marshal. I mean,
Right. They got to be able to go out.
yeah.
Okay,
They're not locked.
we need to move on. We understand the basics, that was the idea, not to
Yeah.
rewrite the plan. Okay. Ms. Jennings, any advice on people that just want to come in the courthouse, they want to do some kind of records research or anything? If there's not an exigent circumstance for it, do we have to?
you can keep folks out of the public building. I was just reading some stuff this morning about literally closing the courthouse, and they're still saying no. And it's still right to public access. I saw them down. Are folks coming?
We had a couple of appointments this morning, and they came in, and then we had one of the title companies that needed certified copies of a probate, and then they said, well, I'll come back and do the search. We didn't have anybody in the office, so we waited in to search. I mean, everything I've read, I can't prohibit them from coming and doing searches.
So,
I can limit the number of people in there, which, you know, we've told them that we're only allowing 10 in.
That's in addition to your staff.
Yes.
It's kind of like here.
I mean, I have 16 employees, so we're over the limit anyway.
Yeah. But they are
They are
dispersed.
spread.
All right, good enough then. Thank you all. Let's talk about item number 6, which is discuss, consider, or take action to establish a COVID-19 pay policies. And this has all been brought about by a number of different acts having to do with this. We gave you all materials on Friday. Linda, are you still with us?
Yes, I am.
All right, thank you. Can you hear us all right?
Yes, I can.
All right, thank you. Let's take one of the easy things. I think that the first, Ms. Brumley developed a emergency pay sick leave request COVID-19. Amanda, why don't you go ahead and go through that, and we'll see where we get with that.
Okay, we just created just a real simple form, just kind of modeled it after the FMLA form. It's just really simple. If, everything that we found so far was there's only going to be a few, very few qualifications for the pay reimbursement if that happens. I'm not involved in that part of it, but if anybody has any employees that either test positive or are officially quarantined by medical or official personnel.
Do you have anything in writing for the court?
There's
Any
one.
kind of backup?
There's just the one email that I got from Thornberry's office. The
Oh.
only thing I actually.
You weren't here Friday.
No.
You didn't get. Okay.
Run, make some copies of that, Judge.
And,
Is that what, one we had
I
Friday, is
did-
that what we're working on?
I didn't bring mine in either.
I didn't
so-
bring mine in, I can
well,
go get it.
I guess you left them at home while y'all were reading them.
I can go get it, it's on my desk.
I've got mine.
Is she gonna bring copies, or we need to go get it?
She's gonna do, she's getting
Okay.
some.
That's okay.
Get something to read.
That's okay.
Judge, last week, I was contacted by the state, and they asked if needed, could they store medical supplies in my warehouse? And I told them that they could, and if they do that, I will let the court know.
We want 10% of what it.
I was gonna say, can we get some thermometers and some?
I do got a key to the place. So, anyway, that's a large facility that could hold a lot of stuff.
Yes, sir.
Judge, did we get a ruling on the general, I guess, rule that since we deal with public money, that it has to be accounted for a little different than if it was private funds, such as paying for somebody that's not at work? I know that was a question early on. Did we settle that,
Well,
or?
that's what we're talking about this morning.
Yeah.
And I did go back and visit with, and send out a deal to everyone over the weekend on, okay, we have had instances where, and Linda or Amanda help me with this, you all are familiar, but what Lou Murdoch sent, not Lou Murdoch, Lou Kreidler sent back to Tommy Smythe when he pointed out that the spouse of one of his employees had been in contact with a person who had been in contact with a COVID-19 person. The general speak, the way that they're looking at it is, unless that person is positive at the time of contact, you're one removed. But what we're gonna go through it here, if you have to stay home to take care of that person, then you fall, there's 3 different categories.
Right.
And what's very important in this is that we put together a policy that you have distinct marking, and this is what the reform's gonna help do, is to identify that, because we have to account for them and have that covered in payroll, because that's what we have to submit. Now, going farther into this, as you read it, then there's, depending on, the government's gonna reimburse us at different rates for the different category you fall in, for up to 80 hours. And my understanding, I think, is the first 80 hours of someone being out, it's used to that. But if you're out that time, take care of someone, or to provide childcare, because the schools are closed, the childcare facilities closed, that's a different rate.
Just the school one's different. The way it's set up right now, everything that was in that email that came out was, if you or basically immediate family, your household, consider your household is most the way that most of them are worded, that the person lives with you, you're in regular contact with the person. You or that person test positive. Those ones are the ones that are covered for the up to 80 hours full pay reimbursement, up to $200 a day. Anything over that, they don't reimburse for. As far as the schools go, and this is what the questions were last week too, is if your school's closed, government's saying they'll reimburse people that have to stay home because your schools are closed. Your children have nowhere to go, there's no other daycare. Now, we had the question of juvenile department and the jail. We can't have all the jailers start staying home because all the schools are closed. So we've already talked to Chief Rutledge and Captain Patterson and Lieutenant Speed. They're all informing jailers, be looking for childcare, do what you can, to get do what you can to get childcare, because they can't have, because of jail standards and things, they can't shut down the jail just because the schools are.
Now, was that a 2/3 rate pay?
That's the one that's 2/3, but that's after the first 2 weeks. So the first 2 weeks all fall into this emergency sick leave plan. That's how that works, whether it be for the positive test or the quarantine or the school. That first 2 weeks, that can fall in there, but then after that, up to 10 more weeks, or I believe it says 50 hours, something like that, that's the 2/3 rate, up to $200 a day.
50 days.
Yeah, 50 days, yeah. So on the form, we just made it really simple. The top of it is very similar to an FMLA form, just asking the person's, name of the employee, your department, your telephone, mailing address, all that. What day you're trying to begin the leave, which would be, that's the thing that needs to be determined though, is because the tests are taking a while, they can take a couple days, or they can take, I've heard some of them are taking a week, to get results back. Are we gonna start this from the time the person takes the test and pay them through the time that they can't come in until they find out the results? Or are we gonna only go from the day that the person actually tests positive? That's the part that's not really clear. It's, the way it's worded in the email is that it's a positive test. But if it takes 7 days for the person to take or get the test results back, are they on their own sick leave for a week? If they're being told don't come in until you get your results? Or how do we determine that?
I would think we start it from the time they take the test, because the testing's not being done unless there's a reasonable.
Certain qualifications.
Yeah, the qualifications are pretty tight in order to take the test to begin with.
Yeah. The way I understand it is you pretty much are showing pretty good symptoms of something before they'll even test you right now.
Okay, but that's the person themselves.
Yeah.
But if it's the family member that's being tested and we got them, and until that comes back.
That's what we need to determine, are we gonna treat them the same way, whether it's the employee, or say if it was me or my child, one or the other? Is it gonna be treated one way if it's me testing versus my child being tested for it? That's the part that's up in the air that they kinda left for us to
But
determine.
are we,
I just want to, this is Linda. From what I read, my understanding is if the employee is subject to mandated quarantine, so if their family member has been tested and they're required to quarantine
That's not self-quarantine.
Yes, if they're advised to quarantine for a medical provider, then yeah, I would assume they could get it.
But, but isn't that self-defeating to some extent? I mean, if, let's say Barry, his wife comes in and, or she feels poorly and she wants to go to the, isn't it advisable that Barry stay home until we get test results back? Otherwise, Barry's hotter than a firecracker by the time she gets the test result, and we've all been exposed.
That's
But
kind
you
of,
gotta keep in mind,
that's
we
the,
have less than 10%
Yeah.
positive on the testing.
yeah.
And they don't know when that period is. That's what no one's determined is when are you contagious.
That's right.
That's the,
Even the incubation period, everything that comes out says that now anywhere between like 2 and 15 days. I mean, it really could be,
Oh,
you don't
heavens.
know if you're contagious right from the beginning or a week into it.
Well, you're symptomatic between 2 and 15 days.
Right,
To be type 4 Mary from your first exposure, we don't know.
right. So that's the thing that's been left up in the air. It's pretty clear that it has to do with either a positive test or medically quarantined or officially quarantined or your school closure. Those are the only 3 things that even qualify at all for this reimbursement. But it's the time period is what we kind of have to determine for ourselves and put into place. Is it from the time they're tested or is it from the time they receive the results back? And is that the same for the employee and their family member that lives with them? Or are we treating those differently?
Just my
I
feelings,
think
I
if
think,
somebody is being tested, they're being told right then to quarantine. I don't think they're waiting for their positive results to come back before they go into quarantine.
no, the tested person, Linda, is different. If they're presumptive for testing, that category needs to be dealt with. It's the family of the person that's being tested.
I think they're telling it, if your family, if someone in your household is being tested, the whole entire family is being quarantined.
Okay.
I know the military's.
That makes sense to me, what Linda's saying there. To me, that's only viable. That's the only way you could actually receive any benefit from it, if everybody clamps down.
There was an individual who went to get checked. High fever, severe cough, had all those symptoms. They would not test him because he was young. And they treated him like he had it. They did not test him because they don't have enough test kits to go around. They're saving those for the elderly. They still treated him just like he had it, but they did not actually test him. They just
did
said-
I
they
would
issue a quarantine order though?
Yes,
Okay, well,
If they do
that
that,
falls
then
there.
but they didn't test him.
That's fine, that's the other category,
Yeah.
is you don't have to be tested to be quarantined, you don't have to be quarantined to be tested.
Yeah, medical
They're treating
necessity.
them as separate, so.
But I still thought that was odd that they, being all the
Yeah,
symptoms.
it is odd.
Fever, cough, everything.
But I guess they're
And
just,
now, you're just gonna go get treated, we're not gonna test you, you know.
But the way the military's treating it, and I don't know if that's just a standard to consider too, is if anybody in your household's been tested, you all are quarantined until those results come back. If they're negative, then fine, everybody go about your business, but if they come back positive, then the way I understand it is it's an extended quarantine then.
well, that does seem smart to me, just to take the precaution.
We start the time clock from the moment the test is administered or they're medically necessary quarantined.
Right.
The employee or household member.
Judge, I don't think one rule fits all. I think it could be a decision based on an individual case. I mean, it could be case by case. Depending on the situation, we need to know all the different variables.
Well, that's
And
where-
then make our decision based on that. So, I mean, I don't know that we can sit here and
Well, you're gonna have different scenarios. You may have a family of 4 that lives together, then you may have a situation where you've got a family of 4 plus 3 cousins that live with you. I mean,
Let's say
you don't know
household.
what the dynamics.
Household.
Household, yeah.
Yeah, they're not saying if you're, your aunt that you saw a month ago or things like that.
Yeah.
They're not considering those. They're saying basically the people you have everyday contact with, those are.
or recent
Yeah,
contact.
so that's the biggest question is when to start the clock. And as long as we have some standard for it, there's still gonna be the odd case off and on, but we'll have something to go off of.
Again, it would be my suggestion to start the clock the moment a member, or an employee or a household member of that employee is reasonable suspicion, tested, or quarantined, medical quarantine, and we have that documented by a physician that,
And we've already had discussions too, that I know, sheriff's office, a lot of them are contacted by text and things like that.
Yeah.
If you get a texted picture of that
of the,
medical note to start with, yeah, we wanna see the original eventually, but get it into us so we can at least get things going, so we have a good reason, they understand why you're not here.
Yeah.
If we do have a jailer who cannot find childcare, are we going to penalize them for not coming to work? I mean, that could be a bridge that we cross. We're not gonna try to provide childcare.
No.
Hopefully not, no.
No.
So those employees in the jail that just come up empty on childcare, how are we going to deal with that?
That's a sticky wicket.
Well, because you have employees who may not work in the jail that may not can find childcare either.
Well, they can be off. The state jail commission says we have to be staffed in that jail.
Yeah, but what if they don't have vacation time or sick time to cover?
well, it's
We're
covered,
gonna get paid.
it's covered
It's
in,
reimbursed.
It's reimbursed. But we're talking about somebody that's mandated to staff a jail. And then we have people that, you know, we're gonna treat like everybody else,
Well,
but
in that jail situation, you're not so much worried about the pay, you're worried about the person being there.
that's what I'm.
That's the deal, because they've got to be, and,
You're gonna
That's
pay
a possibility.
overtime.
yeah.
Phil, what will happen though, if we ever hit that critical mass, you can't work people 24 hours a day.
No,
And
you'll have a bunch of them in
They
city.
got a real cookie.
the courts and the sheriff's department, we're down to right at 400 in jail. That's the lowest figure we've had in a long time.
But it does you no good unless you close some pods. I mean, your numbers are gonna remain the same as if it was 420 or whatever. That's the,
If you don't
yeah.
consolidate.
If you can't consolidate, sometimes you can't.
then if we
So
get
that's
a
a
hot
problem.
case inside, then we've gotta stand up an additional pod, so it throws the math completely
Oh,
off.
it's a mess.
Well, what they are doing is bringing in, Chief, let me let you explain it. Force 4 and 5 here, you've got isolated areas. When somebody new comes into the jail, they're being put there for a period of time before being moved to Sprague or to the rest of the population of the jail. So we're trying to clear them from 5 to 15 days. And the reason for the 5 is if we load that up, we don't want to have that much density. We may have to move people out.
Yeah.
That's really good though.
That's the general guidelines that we're using.
Your conference will expire in 3 minutes.
Linda,
Yes, sir.
okay, we'll call you back. We have to go off for 15 minutes with the public. We can't help that. That's the weird way this thing works. In a 24-hour period, you're shut down for 15 minutes. So is there anyone in the public on the line?
It's called sheltering at home.
All right. Then when that cuts off, what extension do we call you back at?
Daryl, we're gonna have a whole new vocabulary time this thing's over.
Barry, what extension?
8395.
395.
Okay.
I don't know why it's 8395, please.
Okay, good deal. We'll do that.
Okay.
Okay, we're gonna hang up now and call you at that, so.
Okay, sounds good.
Then we'll have to watch to go back on it.
Well, I tried that Friday and it wouldn't let me. It said
Well, at 11:15.
I
No,
tried it at 11:17 and said.
Yeah, we-
this was scheduled this time.
we tried several times, it wouldn't let us.
That's why I'm trying to get CJ to come up with
So
something.
that's why this called into it.
I don't understand why we can't continue,
I know.
We just
Well, we're
need a
trying to
different
get
service.
provider. I don't understand that either.
that's,
You there?
Jeff's got one
Okay.
that we were using.
We may do that. Linda, are you back on there?
Yes, sir, I'm
All
here.
right, thank you. All right.
I think we got a better line.
I just want to let you know, Monte County was using a online provider called Zoom
Yeah, I sent that to George yesterday.
Okay.
We did it for church service yesterday, it worked pretty well.
Oh,
Yeah. But the neatest thing was, for communion, I've never seen this, they had a deal look like a jelly thing. The top of it, you pull the first layer off, you had the wafer. You pull the next layer off, you had the wine. It was a little bitty cup.
I see it.
Yeah. Yeah, they look like, you know, you get those mass deals of jelly in there, you pull cellophane over it. But it worked, but the other worked very well for the parking lot full of cars.
That's cool.
Yeah, okay. We'll resolve that before the day's over. Nancy, does that mean I can't use that again this afternoon, because we didn't schedule it?
It should be ready for this afternoon. It's because CJ's mail said it was good until April 19th. But for some reason, that Friday when I called at 11:17, it said, your conference isn't scheduled for this time. So I don't.
Okay. All right. Okay. We were discussing, and Commissioner Beecham had said if a household member is sent for testing, then the presumption is that everyone would self-quarantine in that household.
That's the way a lot of other, businesses and, military and thing are all handling it right now. Is if if anyone in your household is testing or is quarantined, if anyone's testing, you're all quarantined until the test results come back. If they come back negative, you're released.
Okay, but we want something, there has to be something to substantiate that from.
You should be able to show something showing you took the test or that.
Well, no, the doctor, the provider, that there is someone being tested and members of that family. I mean, we're gonna have to have documentation if we're gonna pay for it.
Yes, that's the way I understand it, is if when doctors are testing people right now, they are issuing something saying, yeah, you're quarantined until the test results come back.
Are quarantined without a test. In the case of the
Or
younger,
you're
Right.
quarantined,
Yeah.
yes.
yeah, quarantined without a test, reasonable suspicion of.
So they should be able to, when they submit the form to me or their supervisor does, they should be able to attach something to it. Whether it be a photo of the note to start with, because like I said, we don't necessarily want people running in here with notes when they just went and took a test. But, if they can scan it, a lot of people's, phones, when you go to take a picture of a form now, it asks you if you wanna scan it. And so it shows up clear. You can do it that way, you can email it, you can do whatever, at least get it to your supervisors, and the supervisors know to get it to us. And then as soon as we have it, we started a spreadsheet, that I forwarded over to, the judge and the auditor's office on Friday, so they can add in whatever columns of information that they're gonna need in order to do these reimbursements, or however that needs to be processed through the government. But we'll handle the forms, we'll handle the collection of the information, so it all comes one place, and we'll forward them all the information that they need. And we'll also be keeping the spreadsheet, so it'll kind of be a checks and balances. We have the same list that they have as far as how many people were out for what reason and how they're being reimbursed or how they're being paid.
Okay, let's look at, there's a document that the cover on it is an email from the auditor making some suggestions, but if you go back into it and look at it, it has this compliance update. And on page 5, and you all may see something we need to talk about sooner than that, but it starts talking about what are the qualifying reasons for medical leave. And then it's must we pay employees during, and it goes through some of those steps there.
Are you wanting us, Judge, to approve this layout or format here and then we'll consider it as first draft and then we can tweak it, I guess, going forward?
I would think what we do is, there's two things. One is do what you're saying and allow a couple of us to work with HR and the auditor. The auditor is, what I really always see it being the function. Amanda will take and qualify the individual, and then she's gonna actually track those hours of people. What we need from the auditor then is exactly what documentation. And one of the key things to doing this that makes it easier is the people who are gonna receive this need to be on Time Clock Plus. And, Linda, did you all put some codes in there in Time Clock Plus that will cover the 3 different, categories?
We're working on that.
Okay.
We wanted to be sure we set them up with how the Commissioners Court is going to need the information. Or we weren't sure if there was going to be other things that go into place before this, because this is going into place April 2nd. So if we need other codes before then, we kind of need that to know that information also.
Okay, I guess what we need to know is who do we have right now that would fit one of these 3 categories that's actually home now?
I've heard of 1 or 2.
You've heard of one or 2?
Yeah, I don't have the actual documentation on them yet because they were waiting to find out if there was anything they needed to submit, so.
Okay.
And I guess they're qualifiable pre-hand,
They're ones that have actually tested or were showing the symptoms and were told to stay home.
but I mean, if they test now, we can pay them in arrears?
Well, I guess that's kind of what we're trying to find out, is because everything I've seen also said April 2nd, but what about the people we've had over the last week that,
Would,
I mean, I've known about the 1 or 2 since.
would we not just go ahead and adopt it and make it effective immediately and then worry about that detail?
We just,
Ma'am?
the only thing is that we will only get reimbursed up to the federal limits, and we will only get reimbursed starting on April 2nd.
Yeah, I understand
So
that,
the county
but
would just have to take care of
we
it
would just,
for the last week while everything's been up in the air. But it's, like I said, 1 or 2 people is all I've heard of, and I'll get the documentation on that.
There is mention of using compensable time that people have sick leave or vacation, but we're gonna have people that don't have that. That's probably the big decision to make, is if they don't have that. And yet there's some things in here that almost look like they get they should get paid.
But don't you think, Judge, that maybe we implement a 30-day, so we've got 2 weeks from today to go into active reimbursement stage federally, but should we not implement a phase 1 program that gives us 30 days, go ahead and cover these payroll dollars up until that time for the occurrences that we may experience, and then reassess or evaluate where we stand after that period of
I
time?
think we just adopt what the federal guidelines are, effective immediately, and I know we're not gonna get reimbursed for that, but we're looking at a few days.
And then it might take some stress or worry off of a few that they actually don't want to go because they think, how am I going to get, I don't have any time. How would I get paid? I don't want to go test because then what if they did it? I'll just suffer through. And I think we would be wise to just go ahead and
Yeah,
cover.
Right now, the liability of the county would literally be no more than 2 people that I've heard of so far. So just with the last week.
No, I agree with that, and I think we set it up. It's gonna be interesting to see how FEMA does some of this, because part of the thing is, in writing this, they've set up these different formulas for pay, and that's where we're gonna have your tracking to give that information to the auditor, so we are in compliance. But while they may or may not pay us until starting April 2nd, when we go under the April 2nd, we have to follow their pay guidelines.
Right,
Do
that's why I've created it as simple as possible. If it meets one of these 2, it'll be at the full pay, up to the 80 hours, and if it falls into that 3rd category, then it drops down to the 2/3 pay for the additional hours.
And our compensation could be 6 months away or more.
And that's, the partial pay is the reimbursement rate. It's up to the Commissioners Court to decide how much they want to pay.
When you're saying that, Deb, you're saying if we would get that reimbursement rate, even if we paid at the regular salary rate, that's all we're gonna get.
Correct.
So it's a factor. I mean, it's,
Yeah.
But then you could opt to pay at their full pay, and then knowing we would just get reimbursed at a lesser amount.
Okay, but I thought those amounts were fairly,
It's 2/3 up to $200 a day, which most employees, I don't believe. make.
that's right, I was thinking the 200 a day, but it's 2/3. So if I make $100 a day, then I'm only gonna get $67.
well, I assume the child care deal will end May 31st. I mean, is that,
Well, yeah,
No.
school will, yeah.
Well, it's,
Do
if you
what?
read the
Unless
guidelines,
it's
it's childcare as well, not just school, but
Yeah.
the ability to get childcare.
but I mean, I thought that was the deal, is since the schools were out.
It says school or child care.
Okay, I was just curious how that's gonna work.
Yeah.
You know, we just have to be very careful here because we've got two different factions and you wanna be good to your employees and take care of them. We certainly all are for that, but at the same time, you've got to have some sense of control because we've got a budget to watch and we're in a tough spot.
We've had it added on the form too. I mean, obviously, I don't know where everybody's children go to school, but a lot of times the supervisors do, especially within the jail, they know a lot about their people and
Yeah.
where they work and how many kids they, have and which schools. So there is a little note on the form. I don't want to know kids' names and ages, obviously, or anything like that.
But
Which
facilities.
school are you claiming is closed and what's the anticipated reopening date? Some of them right now are saying we're supposed to go back in 2 weeks, but if that gets extended for 3 to 4 weeks, then that's just something that we'll keep track of, and that's something we're gonna add on to that spreadsheet that we have too, is as that changes, it's gonna be a fluid form, because
Well,
things are gonna keep changing.
What I'm hearing from a lot of people is school's over in Texas. I don't, you can't hang your hat on that. That seems to be the general opinion now.
That's being championed by a lot of kids in high school.
Well, I'd have been on that team back then. No, I'm hearing that from some folks that,
Yeah.
school board members and people that have their ear to the ground. Because that really makes a difference, guys.
Well-
That's a big factor.
I would think that we could even trigger our policy here that if the numbers became somehow unmanageable,
Yeah.
that we could come back to the drawing board, Barry, but like on your comments, my initial thoughts were, we taxed for the payroll.
We're funded for the payroll.
And so I told the judge early up that it felt like it would stress people to not know or not understand how they could compensate themselves, and I thought that it might compound a lot of issue for us if we didn't do that straight off the bat. Now, if we go into lengthy extended periods, we're going to have to look at what we're doing, but.
At the
Well,
end of the day,
if
we've
it
got-
continues if it continues out longer than this, I would imagine we'd see more federal relief at that point.
I mean, I've looked at this deal as a 30-day deal. I mean, that's just
Yeah.
my deal, and everything will begin to grade. But we don't really know that.
But I don't
This
see
thing
a
may just
reason
be
to
peaking
delay,
in 30 days.
delay acting on this to April the 3rd, because as fast as this thing's moving,
Right.
where are we gonna be on April 3rd?
Yeah.
I think we enact it immediately and absorb the cost internally.
And just hope for the best, hopefully.
Well, right now, we're only looking at 2 individuals that we've identified
Right, so
that-
it's not a
today.
huge
I mean,
cost.
but
Yeah.
we don't know what we're gonna be between now and April 3rd.
I
So-
think whatever y'all decide to do today, I like how the school district's kind of doing things here, at least they're not saying, oh, we'll just close everything for a month or 2 months. They're saying, all right, every couple of weeks, we're gonna revisit this
Reevaluate.
and see how things are going and what needs to be changed or amended, what's working, what's not working, and what needs to be done.
We're in uncharted territory, I mean, which is kind of the conversation the judge and I had with Representative Frank this morning. That, everybody's going, looking for the guy that can make the call, and that guy's not there.
Right.
You just operate on the best you can put together. The data
Tracy.
is not even,
So it changes from day to day,
yeah.
everything.
I mean, if we had a chart we could go to that would give us the expectations, the numbers. In other words, what does the curve look like? We have no idea.
No.
We speculate by looking at Italy and looking at China. Well, the Chinese stuff, we don't know if that's good data anyway, but, boy, you can't draw a conclusion.
Tracy, do we have any concern of a person that comes in and unsymptomatic of anything, stays with us for an over a 2-week time frame, week 3 or 4 test positive in our jail because of outside environment influence to whatever extent? Does that person, as the way things stand today, would they have any recourse to us at all?
Well, as with everything that happens at the jail, unfortunately, the county can get sued at any time, but the more folks that are introduced in there, and then of course that thing's just an incubator with, how folks are packed in there. So absolutely, as far as I'm concerned, liability wise, that's a huge concern. You get one person in there sick, and that deal's blowing up. And I cannot say to you that, well, if we get sued, everybody's gonna understand this is coronavirus and no big deal, because that makes sense to us, but I don't know that that's gonna be how it comes down, because of course there's a concern.
The main thing is everyone's getting screened, even the officers. And, again, they're screened before they come in, and if they have any kind of symptoms, they're sent to the hospital.
Yeah, you're doing
But
due diligence.
It doesn't really, you don't have to be symptomatic. You can be exposed to it and be a carrier and infect a whole bunch of people and never know you're sick.
As far as the liability part of it is,
Yeah.
we're doing everything we can.
Doing all you can do, that's all you can
And
do.
once they go up there and then we find out, shoot you out, then they're gone. We're doing everything.
We could arrest somebody this afternoon that got exposed yesterday and won't show any symptoms and still, create a problem.
And interact with a whole bunch of folks in the jail.
That's the
That's why
unknown.
they're separating them on
That's why they're
intake right
separating them
now,
out.
so to make sure that they don't become symptomatic.
Well, and my concern wasn't so much prisoner to prisoner as it was a guard that eventually test positive that brought it into the jail, and that was my concern.
But that's the thing, I mean, prisoner to prisoner, it's gonna be guard to prisoner. And,
Yeah.
When you look at how it increases exponentially, but again, then we're right back to, we can't just shut the jail down.
You can't.
And there's only certain folks that we can have in there.
All you can
What
do
if
is due
we-
diligence, and
what if
that's
we
what
have
you're
a-
doing, so.
Have a jailer that contracts it and takes it home to his elderly parents. I mean, this thing's just, it's got all kinds of,
Yeah.
Well,
But the main thing
or
is
his
we're doing
elderly
everything
commissioner,
we can.
or-
I mean, even the officers have to have a temperature, they have to go through all those questions,
Yeah.
just like there was an inmate.
does, and I don't guess that we are insured against that in any capacity for emergency purposes.
Now, that's starting my second full week here, sitting here today. I'm way above my pay grade. Any sort of opinion about that, I'm so sorry about that.
second week in a whole new scenario.
Second week, brand new.
Hey, we're all way above our pay grade on this deal, so.
I'm just saying, I hate to tell you yes or no, or
Yeah.
You know,
that's something that hadn't even been considered.
Tracy, Commissioner Harvey refers to that as about as wild as changing your oil driving 70 down the highway.
Well, if I only drove 70, that would be accurate, but I drove faster than that, so I'm with you.
I've done that, but not on purpose. Knocka, 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 knocka.
Well, and that's why this is such an important conversation.
Yeah.
When we're talking about who's it gonna extend to and what is the time period, because we don't just have folks within the courthouse, folks are going home to their families.
That's right.
We do have folks that are interacting with when they come into this courthouse. And you have somebody who thinks, do I have to go to work today because I'm not gonna get paid? And you know, we just gotta do the best we can to try to not be a vector here and or our employees.
Right.
You know, as much as we can within the law. That's the hard part. There, and I wish I had the answers to all this. 'Cause
And
it's
it's-
I'd be
yeah.
somewhere else making a whole bunch more money.
At the end of the day, it's not gonna be fair to everybody.
It is not.
It never is.
It is
And
not. That's
But,
absolutely.
in reality, whether this event was going on, we have people come and go to the jail, inmates, guards. I come in, I don't know, I have the regular old flu.
Judge, it's not the flu, regular flu, unless there's something really bad in killing a bunch of folks.
Okay, but what I'm saying is, this is incidental to the operation. It's not that we're not worried about it, we're not taking it. Same
Yeah.
thing, we test for TB, we do these things, but there are gonna be times that, because of those conditions and confinement of lots of people, diseases can be transmitted any number of different things. And so it's when we provide reckless endangerment, we're not doing good things, we are doing things, we're checking temperatures, we're asking people how they feel. I believe, you know, we will live above the standard by what we're doing. And so, can somebody still sue us? Yes, they can. But can they prevail is a different thing.
Well, and here's the other thing, where'd they really get it?
Yeah.
I mean, that's a whole nother issue.
Yeah.
Sure, why
Is-
sure.
Yeah.
How can folks truly say? I
Right.
mean,
Yeah,
this
it
whole
doesn't-
deal is just so.
it doesn't have a serial number on it.
Well, if you've been in jail for
Yeah.
6 months, it's a likely thing you do.
Well,
Yeah.
right, absolutely, folks have been there all the
Yeah.
time, but it's still, it's hard. But one other
Somebody
question-
told me that anybody with $35 could file a paternity suit against the Pope. Doesn't have to be true, you can sue anybody for anything at any time,
It's true.
just, it's.
And they do. And they
Pay
do.
the
You
fine.
just, again, it goes back to doing due diligence and move on. You can't worry about things that are out of your control,
Sure.
so.
You know, there's a thought comes out, okay, employee Y calls in and says, I really don't feel good. And the department head or elected official says, okay, you're the third person this morning, there's only 4 of us in the office. I really need you to come on in. That person comes in, and then it turns out they're positive. Now, did we cross an interesting line there or not?
Of course we do.
Okay, that's what I'm thinking too. If that's gonna mean that office is only manned by that one person, then or it might mean everybody in that office, and the office is closed.
Sure.
It's beyond our control.
Beyond
Then
our
I think
control.
that gives us, we do it on the side of caution of not having, because this is not like shooting BB guns at each other. These are deadly bullets, and I think we have to prevail on the side of the person that calls and their responsibility to themselves, their job, and go with that. I think we've got to err that way. If it's an error, I don't believe it will be. I think having him come in may be the error.
Supervisor department head's response just needs to be that they get into medical as soon as possible, because then they could at least get that
Yep.
recommendation from medical saying, yes, stay home. And it might take them a day, you know, if the
Yep.
department head tells them today, no, you just go ahead and stay home, but send me that notice as soon as you got it. It might take 24, 48 hours for them to get in because of how busy they are right now.
Well-
But at least you would have one coming, or know that you're gonna have something saying that, yes, this person needs to stay home.
The recommendation is always to call a physician first, not to go in.
Yeah.
So
Right,
we need to let our supervisors understand that, to advise their staff to call a
Contact
physician,
medical, yeah.
contact the medical, and get their advice.
If they do want you to come in, they want you to come in a specific manner and not to contaminate their waiting room.
Right.
Police in North Texas was doing it in their parking lot, they were screaming. I mean, there's some good innovative things that are taking place.
So until the employee has a doctor's note, will they be using sick and vacation time, whatever they have available?
Well, that just took that thought out of my mind. If they all of a sudden come back 3 days later, 4 days later, they couldn't get anything from their doctor because they decided not to go, then I think they just bought that time.
That'd be their own personal
Yeah.
medical.
Yeah, and if they don't have it, then they lose those days, but
So what if we have an office that the elected official just closes? We just pay those people?
You would pay those people. We
The
typically,
elected official says my office is closed
we do that now, and we
my
pay
people
those
are not coming to
people.
work.
This is
Not
far
been 2
more,
months.
this is far more, concerning a situation than we close half a day for hotter than hell, we close for everything under the sun, and we pay those people on those times, so why would we not
Yeah.
pay them?
You're not, that's apples and oranges. We're talking about, say, the tax office.
no, what he's saying is the threshold is so low, Commissioner, that there is no threshold. If-
What I'm
if-
saying is, can we close an office, just close the county clerk's office, the district clerk's office? Patty says, my people are not working until we get this crap figured out.
Well,
We're staying home.
we have
So how does
this,
that
that's
affect
why
the
we're
rest of the
talking
county?
about this policy. So she can do that, certainly, and this rule applies for that. But if they
She's not a
exceed,
doctor.
if she exceeds this time, I know, but we're trying to keep it from being, so Einstein has to come down here and do the math on it.
You've got, some offices are under different standards. Patty's office and Lori's office are offices that provide the records of the court. And the records and the access to the court, I think are still looked at as pretty sacred. Nobody's offering any exceptions on that. So whether it's just Patty in there or just Lori in there, they could be compelled to come in there. I think it's by court order necessary.
I'm concerned that our staffing, and it's not fair to the auditor's office, I don't think, to go this direction, time bank it, come back out of that direction, time bank, receive funding from federal government for reimbursement. It's convoluted at that point, and it becomes very tricky and time consuming to manage. And I'd say simplify the policy as much as we could for a given period of time, and if we see we're gonna be prolonged, then we know we have to tighten it. But if we compound our staff with all these regulations, they're gonna have to jump 90 hurdles on
Okay, I
to
want
get
you to
payroll.
stop for 1 second. I'm not talking about these regulations. Okay, I think these are fine. I'm talking about shutting down an office that we have nobody sick in, none of their kids are sick. We're just gonna close our office. We're closed. We're gonna be closed for 60 days. Check back with it.
Well,
What about, I mean,
there's.
can we just make that call?
Okay. The Jenny's did a long research at John Gillespie's request, and it supports the elected official's decision in AG opinion after AG opinion.
Okay?
So if that's done, then, but I think certain elected officials have to be careful of what their constitutional job is, and that they may not have that leeway simply because of their requirements to the open courts concept. And so, while right now, and I don't know, Ms. Flores, if you close your doors, people have to have a reason to get past the door, they're walking. Okay. Lori's has closed her office. She's taking people in, but she's limiting the numbers. She'll give them access to what they need, but it's not just walk through the door.
But it's still functioning.
It's still functioning.
I'm talking about somebody closing the doors and said, see you in 60 days.
Okay, I can just tell you where, I don't know whether there's case law, but I should be glad to furnish you that list of AG opinions that support the elected official being able to close it, whether it's for the convolution of traffic by hotter than hell, which isn't a real case, because you would need to leave until earlier than 4 o'clock to be out of the way of the race. But don't get in the doorway at noon. A lot of offices close at noon, and you're not gonna change
I
that.
don't even know why you're talking about that. That's
You're
nothing
I'm
to do
just
with what
telling
I'm.
you.
Actually, it
I'm
is.
telling
It's
you,
the same
they
thing.
do that,
Charge
mean
all.
they can do the other, and you don't have much
You,
room.
you
We-
take
we've
the
already set a
services we
precedent.
provide away from the public for a half a day, we can get over that. You close an office for 60 days,
Okay,
that's pretty tough.
let's just use the tax office.
Well, past tax season, isn't it? All that
Okay.
stuff's out.
The tax office, the only thing that they haven't been given leeway on is on their collection of property taxes. That hasn't come down from the governor yet. But everything else, the renewal of your license tags, all that has been suspended until this is over. So I mean, if you talk about, they're trying to provide a service to keep things flowing, keep people in, take care of title transfers, but, you know, now, that may not be the best overall decision if he decided to close and not do anything.
Well, I'm just saying, can we do that? Can we just say that? But by law, you're telling me that as an elected official, I can say precinct 2 is closed until further notice,
I think.
And we would, as a county,
AG opinion,
pay our people.
yeah, I don't know if there's any case law on that.
But we as a county would pay my people,
Yeah.
Yes,
just like they were there,
yeah,
and they wouldn't have to come in.
But you'd have to stand the scrutiny of the voters in the next go around. I mean, that does have a little bit of impact on it. I mean, you did take an oath to.
I understand that, I'm not about to close law.
No, I understand that, but I'm just saying, there would be scrutiny, but not immediately, I assume, from what I'm hearing.
Jack just texted me earlier, when we first started, that said Archer County, according to Big City Concrete, their road and bridge has closed up.
yeah.
To me, that's crazy, they're out there by themselves, or working on the side of the road.
Well, I instructed my guys, just simply because they're older, to not be going to run parts and supplies and stuff to
We got
Neo.
Neo for that.
Neo needs to go every bit of it, and I told Jack, you gotta go the extra distance to make somebody stand at the part house. We're just gonna have to do it. I don't want them out there being exposed. I just don't wanna take that chance. So, they didn't argue with me or,
So all your people just stay home?
no, I'm saying that, still don't mind them working, I just don't want them to run to Wichita and go to Atwoods and pick up something, all that needs to be done by Neo.
Well, I think every office is doing what they need to do to modify their practices right now and giving forth a good effort. I know, like in Tommy's case, for instance, anybody that's coming in for motor vehicle transactions, he's turning away because he's got multiple other ways to perform those functions, so.
And
he's not,
And they've been extended too, so people
Yeah.
don't have to do them.
so right now, I don't think any of us are in that position,
But I mean, I certainly support if they start feeling encumbered somehow,
well,
and especially in this initial phase, Lee, that,
well,
you
in a small office, it could be a
just-
reality that everybody in the office is sick and they
it
have
does,
to shut down.
it bothers me because
So
I,
it's a different circumstance.
Yeah.
One of the things that bothers me, and I'm gonna hope, as we give people this latitude, they take the responsibility to stay at home.
Yeah, actually, Judge, that's probably the challenge right there.
That's the challenge.
Yeah.
This whole thing
My guys
right
will be on the
now,
lake.
with the debate on, you know, you have mandatory shelter in place, which would be very difficult to enforce. People ought to be sheltering in place because of the danger to them and their families and others right now. Some of the grocery stores, and places, apartment stores have made deals where they've got people queued in lines, you stand 6 foot apart. There may be some implementation of that kind of thing. Curfews may be a thing to look at. But I think the real thing is, if we let people stay at home because of any of these reasons, then quite honestly, they need to stay at home.
Yeah.
That's a good point.
And that might be something, a mandate you have, you might say, excuse me, but we're paying you to stay
At home.
I think that's what the schools run into too. In fact, somebody had made the statement, said that doesn't mean we want you all at Chuck E. Cheese and the trampoline place and wherever.
They're all closed down anyway.
Yeah.
It's the extreme burden of an inclement weather day. When you close the courthouse and tell people don't come into work, we aren't saying go do whatever you want all around town. We want you to stay home and be safe. Just like now, for health reasons, same thing. If we're telling you don't come into work in certain departments, that means just go home. And I think a lot of the restaurants and everything else being either shut down or very limited helps with that too.
Makes a difference.
Just, there isn't anywhere.
Nowhere to go.
Or anything to do.
But the lakes are not closed, the golf courses are not closed.
Right.
I mean,
Right.
We got 99-cent gas and nowhere to go.
I need to fill up my big tank on this.
Yeah.
I hope it's temporary.
Let me ask you this, could we kind of pull this together, and I've been making some notes of some things. That, okay. Some things we've kind of talked about is, one, we need to adopt these federal guidelines. And second, then, are we gonna pay our personnel at full pay, or are we gonna use the federal guidelines? And I think for simplicity, I would rather we looked at full pay, as long as we can do that, and we apply for the federal reimbursement at the rate they give us, until, if we find all of a sudden a point that we can't do that. There may become a point that we can't make the checks good.
This whole deal could change in 10 days.
Yes, sir.
I would make that motion
Let me,
and, okay.
excuse me, let me get a couple, okay, full pay, adoption of the federal guidelines. If a household member is sent for testing, then everyone would self-quarantine with documentation. What else should we try to get?
Or if they're medically quarantined, even if
Medically
the
quarantined.
ones that can't test, but they're saying you meet all the standards, we'd like you to quarantine, if they have medical documentation that says quarantine, even if they didn't test. And that applies to family members as well.
Okay, I'm saying sent for testing are placed in medical quarantine.
Without
They
test.
both should be able to provide some sort of
Yeah.
documentation.
And
I think you've got to require
say-
documentation, guys. I think that puts
Yeah.
a control on it.
And,
That-
Do
and
it.
we also want to start this now.
it started immediately, but do we want to time limit it so we have to readdress it if, in case we do want to look at the 2/3, if the
Well-
thing goes on for 6 months?
Well, I think we look at that and see, I don't think, I can't, my crystal ball won't.
No, I know, okay,
But with that's incumbent with our responsibilities.
okay.
Is that everything we're doing now, which, talking to one of our state representatives, said, well, what are your decision points? What kind of data are you gonna use? I said, should I use the very reliable data on Facebook?
It's accessible.
Well, I mean, all this, when you look at all the different sites between the WHO and the state website and the local website, none of them are aligned. There's a delay, a lag somewhere, so.
Judge, they've also changed to where they've added like an emergency family medical leave too, that doesn't have anything to do with your pay status, it can run with it, just like your normal sick leave and your family medical leave can, but if somebody themselves was tested and came down with the symptoms and everything, they can go ahead and, fill out the form to be on family medical leave as well, because after that 80 hours of pay, some people aren't recovering in 2 weeks, some people it's taking a little longer than that, so the first 2 weeks we pay, then after that, would we flip them into any sick leave or vacation leave that they have, and it would pick up from there? So we just switch from the federal rules right now,
Yeah.
saying that we'll pay you from this emergency fund for the 2 weeks that you're out. And if it takes longer than that for you to recover, then we
Well,
will.
does the federal rule, does it have a limitation on it? I don't really.
It's 80 hours.
Oh, okay, it is,
And
you're
it's
right.
So
capped.
that's the reimbursement part, but
Got
that's
it.
what I want to make sure we have clear too, is that.
They're not going to commit
So
themselves.
the way I
to-
understand it is this is a separate time clock from regular FMLA. It
Right.
starts, it runs out, then FMLA picks up
Regular
when this
family
one.
medical leave follow. Yes.
But aren't we also exempt from, our federal withholdings during that time frame? I thought that federal
No,
withholdings were
there's a tax
limited.
credit for business, but I don't believe it's,
That's on the back, Mac.
I thought that we were,
Other provisions of upcoming legislation.
for just
Tax
a
credit.
duration of time, exempted.
But reading this, it says the act provides for a combination of unpaid and paid leave.
Right.
Okay? The first 10 days of FMLA may be unpaid, but an employee may elect and an employer may require an employee to substitute any accrued vacation, personal leave, or sick leave for the first 10 days. So the federal regulation says you're gonna use your sick days and your vacation days before you get paid.
But up above that, it had already talked about the first 2 weeks that somebody's out for a positive test or quarantine, they can be paid the 80 hours. So it's kind of confusing the way they have it written in there. I had to go back and read it a couple times as well, but it goes, EFMLA, they're adding it on as kind of an afterthought. They're saying those first 2 weeks that somebody's out for either a positive test or medical quarantine, they can be paid and the government would reimburse for it. And then your FMLA would kick in after that. So that's just the biggest thing, we have to make sure that it's all understood through payroll and everything, that if they pay.
Then what are they referring to, Amanda, when they say that the first 10 days is unpaid unless you use your vacation or your sick time?
Oh,
That's the part that was confusing because it added to that, but we talked about that a little bit when I was up here for a meeting with Judge too last week, that.
Well, I'd like to clarify that. When does that apply?
Commissioner Harvey, my understanding is that's on the expanded FMLA to care for an employee's child. So if they're qualifying for the expanded FMLA to take care of their child, the first 2 weeks are unpaid, but they can use the first 2 weeks as paid sick leave for caring for their child. So it is a bit confusing, but basically all 12 weeks are covered at 66%.
That's 66%. Okay.
okay. Effective date of this. What I would suggest is we make the declaration on March 16th. And I don't think we had anyone out prior to that we're aware of.
No.
That was about a week ago, right?
So, yeah, that would be exactly a week ago.
Yeah, I think that would cover, it was about Tuesday or Wednesday that I heard that first of the 2. So I think that would cover it.
And we can always revise that if we have documented information, maybe start prior to that. But that's really kind of the beginning date for Wichita County for this whole thing, and we were one of the early ones to do this. Okay, let me see, and anybody help me, I'm gonna run through this litany of things.
Judge,
Yes,
before you start on your litany, have we addressed how long the county would pay before they have to start using their sick and vacation time yet?
no,
Deb, I think that should be, unless you tell me otherwise, that we should implement this for a 4-week time frame initially, and then reevaluate where we stand, or through 2 pay periods possibly. And does this need to correlate to a pay period?
That's certainly fine with us. As far as the 4 weeks, that'd be a commissioner's court decision. And it would be easier on a pay period, but absolutely not necessary.
Okay.
I think Barry's right. 30 days from now, we really need to look at it again.
We'll have to.
4 weeks.
okay.
Yeah, we'll be more, we'll have experienced a lot more involvement with it by that point.
Sure.
Okay, so review, and let's make it, we say 30 days, let's pick,
Payroll and then the HR office too can kind of provide Commissioners Court with an update every couple weeks or every week as they want.
We'll have some data.
Let you know that we've got, 2 or 3 people
When
that are
payroll starts.
on this status.
review pay.
When did the last payroll start?
So payroll started, new period started last Friday.
It started last Friday.
Well, Deb said it wasn't, critical that we,
So we'd be better off starting today.
I think you want to cover the people that have already been out.
Yeah,
Oh.
that's why, and
You'd have to
March.
go back at least half a pay period then.
March 16th is a quantifiable date in the declaration. If we looked at, this is the 23rd, if we reviewed it again on Monday, April 20th.
Yeah.
So we have that as an agenda item to review this policy and look at it, and determine it.
And hopefully by then it'll be a big to-do over nothing.
Yeah.
That would be a great.
That would be a great thing.
So Judge, if we started on, March 16th and we're going for 30 days, that puts it at April 16th, which is coincidental at the end of the pay period, but it's before your March 20th meeting.
Well, that would give us all that data and
We can
time.
discuss it during the Friday Commissioners Court.
So we would not
Or you
have.
could, yeah, or you could, we could report it, Amanda said, on Friday at that work session, but, depending on how things go, we may limit this to one meeting a week and quit having this frequent, you'd have to review bills on your own and look at them. I mean, guys,
I think that's prudent.
I sure did like your camaraderie though.
I think we would need to have some guidance for elected officials and department heads to know if those people were gonna be paid on the 17th or not. That's my only point.
We don't meet on Friday, we don't have anybody to argue with.
Well, okay, we're gonna pay through that pay period and reevaluate. It would be progressive, not retroactive.
And really, the only thing we're reevaluating is the level of pay, not, I mean, federal guidelines are in place at that point. All we're looking at that point is, do we extend it out, the full pay or the three-quarter pay?
2/3.
2/3, whatever it is, whatever the figure is. That's the only
Well-
thing we'll actually be reviewing.
Well, I
because-
think in this first 30-day timeframe or through the dates the judge is speaking of in April, that we keep it full pay and
No, I
we talk
agree.
about it
Yeah.
as we progress. And we don't have to wait till then to talk about it. We can talk about it as we progress.
Okay, so the things I have down is, if a household member is sent for testing or placed in medical quarantine, then everyone would self-quarantine with documentation. In other words, something from a doctor, which would cover our support of our personnel. Everyone will draw full pay, adopt federal guidelines, include current personnel that are on it, that March 16th being the date from there forward. And then we review this on Monday, April 20th, unless there's reason to bring it up under staff reports prior to that.
So moved.
I like it.
Second.
So only people that are being medically quarantined are gonna receive the full pay, or is that people with childcare issues also?
No, it's federal guidelines state setting.
Well, that federal guidelines on childcare is only 66%, so I just wanna,
No, we're gonna pay everyone full pay,
okay.
as long as they document it for, the same thing on childcare.
So with the codes and the time clock system, the supervisors will use those, but then payroll will also just, count on whatever forms we receive. If they have something showing the system that they put in this type of leave for someone and they haven't received something from us, then similar to FMLA, they would check and say, have you received anything on this person, and anything we get billed for that way as well. So one of our checks and balances for both.
And documentation, Judge, would be, so if, again, Sherry is testing or has issue, Sherry's documentation is Barry's documentation, correct? There's not a need for Barry to
Yeah, in other
go,
words, I bring her
yeah.
deal.
Yeah.
How you gonna
submit the form marking that it's,
Yeah.
your spouse has tested and you're awaiting results, or
How
you're
you-
quarantined, yeah.
How you gonna document the child care deal?
The childcare, the only thing we have, because we can't ask for too many details.
Just
but
ask for facility.
We can ask, it's got on the form to ask for which school or facility and what the anticipated opening date is. That way, we can check, I mean, news articles and things like that, you can check in
And
with
what
the-
you're-
with the places to see when they're gonna reopen. So-
Yeah, what you're doing is you're having to document a negative, which is really hard to do. In other words, I can't find child care. I don't know how you document that. I'm just,
Well, your regular
Who'd you have your child with before when the schools, you know,
Right.
you had them in school, but where did you
Yeah.
have them the week of spring break? Well, I was on vacation and I took care of them.
Well, that's, yeah, but,
Okay.
and where are they gonna
I
go
think that's
in-
gonna be part of
yeah.
Amanda's job. is
That's,
to-
that's what we're trying to keep.
case.
yeah,
Yeah,
where are they
we're
going in
trying-
May, you know, I mean, at the end of May, that's,
Grandma.
Right,
Yeah.
right. That's what we're trying to keep the
Yeah.
auditor's office from having to deal with. We're trying to get it to where we'll
Can't
put
go
the
to grandma,
information,
you kill
we'll get
her.
them whatever bits and pieces they need, but the 40 phone calls you get, you know, in a certain
Yeah.
amount of time about, well, I tried to do this, I tried to do that, this is the information I have. Sonia and I would be fielding that information, and then they would get what they need and not the whole overabundance of everything else that comes in.
childcare deal's a tough one.
Yes, ma'am.
You have full access to the time clock, so if you'll just review that on a daily basis, so we're not gonna catch it after the fact, so that if you see that COVID, code come up, then you can immediately check your records and make sure they have it, that you've got the form.
How do I review that? I've never reviewed like the entire county's time clock before.
We can show you.
Okay.
Yeah, I think you could probably sort it by the COVID-19 things. One other thing we need to have in this, everybody that's on this has to be on Time Clock Plus. It's just, that makes the
Yeah.
documentation for federal claiming so much easier.
Time to do it anyway.
Well, it's been a long time to do it anyway, so, at any rate, I'd like for that to be included. Is that agreeable?
Yes, include that in the motion, please.
Okay, I have down, Mitchell made the motion, Watts seconded, so,
Yes.
okay. Anyone can think of anything else. And I'm sure that's, about an hour from now, those thoughts will come due.
You're right.
But we can revise this is gonna be a living policy. And in some of those things, when Amanda runs into, I'm not sure, Commissioner Beecham and I are the two that work with her office, and I think with the three of us, we can come up with a workable solution. And the justification and reasoning behind it.
Right.
We wanna try to treat everybody fairly.
True.
Judge,
Yes,
one
sir.
last question, I think. Are you gonna address in this policy any overtime that is worked by exempt employees?
Okay, from a standpoint, okay, our emergency operations plan says exempt employees working overtime on this are to be paid at their same hourly rate. Now, the question is, what triggers that? And when Nancy and I were kind of talking through this the other day, she worked all day long on doing stuff that we were rewriting and getting out on COVID-19. And then we stayed and we did the agenda afterwards to have it ready for Friday morning. Well, she should be qualified then for an hour of additional time.
As long as it's documented in the Time Clock Plus system that the COVID-19 task code is used, and then there's a comment that describes the actual task that was done, our policy has always been to allocate the overtime hours to the disaster first.
Right.
So,
And even though somebody said, well, no, she was working on the agenda, well, she had worked 7 hours already on the COVID-19. So people have got to think through that and be realistic about it.
You would've told me I need to get my priorities straight, just deal with it.
Well,
That's what you'd have told me.
and I'll tell you again,
Yeah, no.
but, you know, that's what we got to look at. I don't want people to think, well, I have to do it after, 5 o'clock. No, that's not what we mean.
No, the underlying reason for her overtime was because of the COVID response.
Yeah.
So,
but Judge, also, we have to know all of the working hours for that week, because we have to prove up the working hours. So they have to be in Time Clock Plus, and they have to be recording their tasks all day long, so that we can see what the so the FEMA is gonna have to see what their 40 hours are dedicated to, and then what their overtime hours are. So, it wouldn't be enough that Nancy just worked 39 hours on her regular duties and 1 hour on the COVID. It has to be that she worked 41 hours, and 1 hour of it was on the COVID.
Right.
And all of her tasks have to be on a contemporaneous basis in the time clock system.
Okay. And there's some pretty general categories for doing that, or all that. Okay. gang, we're just gonna do the best we can do with this. And I don't think if we managed to master all this in 47 minutes of talking about it, I'm impressed. Not that I'm not impressed with y'all all the time, but, this one will be a little more. Are we ready to take the vote on this?
Read it one more time. We changed it so many
Gotta
times.
read real slow.
Just read it.
Okay. The first thing is, if household member is sent for testing or placed in medical quarantine, then everyone would be self-quarantined with documentation. Of course, the simple thing, if Sherry came back, she was positive, Barry had to stay home.
Her documentation is good enough.
Her documentation covers him. Okay, everyone will receive full.
But I'm the only one, right? No.
Yeah.
You need to add the childcare.
Yeah.
Yeah, if you have childcare, you've got other problems, Mark.
Yeah, that's true.
Okay. We're gonna adopt the federal guidelines. We're gonna include the current personnel and, beginning with March 16th. We're gonna include those, if they have childcare situation that qualify them to be paid. Everyone will use Time Clock Plus that's doing this, and we will review on Monday, April 20th or sooner. That get it?
I think the only thing that's missing is the child care along with the employer household member that's tested or medically quarantined or lacks access to child care.
You were talking about that with the federal guidelines.
That's it, that's
Oh,
included in the
that's-
federal
that's-
Oh,
guidelines.
okay, and that's in the federal guidelines, right?
Well, so is the other stuff. So if we're gonna say one, we need to say them all to make it clear. And we're making this effective March 16th.
Yes.
And we're paying full pay, not 2/3.
Full pay.
Full pay.
Okay, I didn't get what you said we left out about childcare.
Well, you mentioned the provisions if they are tested or medically quarantined or they lack access to child care. Those are the three conditions.
Okay, so I had childcare, but I'll write lack access. We'll take Nancy about an hour to get all this. Just a little more. Okay. All those in favor, signify by saying aye.
Aye.
Opposed, same sign, motion carries 5-0. All right, besides mentioning church barbecues or anything like that, is there anything of significance that commissioners need to report at this time?
Just continuation of cancellations like the Vietnam War, meeting they had scheduled in Owl Park. But
And Judge, I have received a quote from Jeff Nolan, which I forwarded to you.
Okay.
And Darrell, Will is here today.
Yes, sir.
We may need to flip that, I may need to flip to you and him and let y'all take a look at that as well.
We've got to find out where that would stand financially. I also sent that to a couple other people to look at. I copied you all. Just, you know, I am not in doubt of the integrity, but I haven't found where that's, no one knows how solid that is. And if we're talking about 200+ thousand to do this, we want to know.
Now the annex was 28.
Just
28,000?
28,000.
The annex, Scott Street annex.
No, the jail.
Jail, oh, okay. Out
Yes,
Sprague?
yes.
Okay, how are we gonna move the personnel and do all that get worked out?
We're gonna have to hunt.
I think, I wanna hear more discussion on what that leads to. Is that-
And-
Something that Chief Rose is gonna need to be involved with.
Okay.
Right, and it looked like, Judge, that was coming in according to the square
About
footage,
half.
about
About half
half
what he
of
said
what
on
he
Friday.
had
Okay.
originally talked about. It wasn't the dollars,
What
more like
else we
50.
got?
We are still collecting, taking donations for Don Farmer's family. We're getting really close to the insurance mess being settled. And we did go shopping for a new home.
Okay.
We located that, but anyway, we just like to
Yeah.
remind people that we're still in need for Don and his
That's good.
family.
Thank you. Anything else? All right, sorry, it's 11:59 and we're adjourned.